Ulnar variance. Ulnar variance is the length of ulna compared to the length of radius at the wrist. Diagnosis is made radiologically by PA wrist radiograph. Positive ulnar variance indicate a longer ulna compared to the radius, and a negative ulnar variance indicate a shorter ulna. Neutral means both the radius and ulnar articular surface at the same level. So anatomy, neutral ulnar variance means the difference between radial and ulnar length is less than 1 mm. Positive ulnar variance means the length of ulna is more compared to the radius. So positive ulnar variance is seen in pronation and during hand grip. Negative ulnar variance is seen in supination. The positive ulnar variance means ulna project more distally. Here you can see in this image, the ulna is more distal compared to the distal articular surface of the radius. Next is negative ulnar variance. Here you can see the distal articular surface of the ulna is more proximal compared to the distal articular surface of the radius. So what is the pathophysiology? Congenital causes like maid-lung deformity will cause positive ulnar variance, and reverse maid-lung deformity can cause negative ulnar variance. Trauma like distal radius ulnar fractures can cause shortening and angulation, which will result in ulnar variance. And growth arrest like Salter-Harris class fractures in pediatric population can cause growth arrest of radius or ulna, which can cause ulnar variance. Distal radioulnar joint injuries occurs in Galaxy fracture dislocation or in Essex low-opacity fractures can cause ulnar variance. So iatrogenic causes like joint leveling procedures like radial shortening or lengthening, ulnar shortening or lengthening, and radial head resection can cause a positive ulnar variance. So associated condition, positive ulnar variance can cause an ulnar impaction syndrome that ulna can impact into the carpal bones, which can cause arthrosis, and triangular fibrocartilaginous complex tears and lunotrigetal ligament tears. Here you can see the length of ulna is more compared to the distal articular surface of the radius. So this can cause an ulnar impaction syndrome. Here you can see the TFCC tears. Negative ulnar variance means the ulna is shortened, so the distal articular surface of the radius can compress into the lunate, which can cause a Kienbock's disease. And one more problem is ulnar impingement syndrome. That means ulna impinges on the radius proximal to the sigmoid notch. Here you can see the ulna is shortened and the distal articular surface of the radius can impinges into the lunate, which will cause avascular necrosis of the lunate, which is known as Kienbock's disease. Here you can see the shortened ulna, which will impinges into the distal radius proximal to the sigmoid notch, which is known as the ulnar impingement syndrome. Next is the classification. Depend on the length difference, the load passing through the radius and load passing through the ulna will vary. So positive ulnar variance means the length of ulna is more and load passing through the radius will be less. When negative ulnar variance means the load passing through the radius will be more because the length of radius is high. So imaging PA view of the wrist with the shoulder abducted to 90° and elbow flexed to 90° in neutral forearm rotation is the ideal view. And the method to determine ulnar variance, you have to draw two lines. One line is tangential to the articular surface of the ulna and perpendicular to the shaft. And second line, which is drawn tangential to the lunate fossa of the radius and perpendicular to the shaft of radius. Here you can see, can draw two lines. One is through the articular surface of the distal radius and one is through the articular surface of the ulna. If two lines are at the same level, that is zero variance. If one line is distal, if the radial line is distal and ulna is proximal to this line, that means a negative ulnar variance. So if the ulnar tangent is distal to the radial tangent, that means positive ulnar variance. If ulnar tangent is proximal to radial tangent, that means it is negative ulnar variance. Treatment is always depend on the specific condition. That's all for today. Thank you.